it's Danielle Radoichin, and this is In Talks With, a series of bite-sized chats about culture from lockdown and beyond. Hospital Rooms is a charity which aims to help mental health patients in NHS hospitals, working with artists such as Julian, Opie and Richard Wentworth to create pieces for and run workshops in the wards. I spoke to Niamh and Tim A. Shaw, the founders of the project, on the 8th of May 2020, about the innovative ways in which they are working to take it beyond the confines created by the COVID-19 pandemic. So, hi, Tim and Niamh.
Hi, Danielle. Thanks for having us.
Such a pleasure. Unfortunately, we are, well, I don't know if it's unfortunately, but we're all in London. But we're speaking to each other over the internet due to the COVID-19 problem. How are you?
We're well. We are, as you say, holed up in the flat and doing as much as possible from here and kind of getting used to it, but also really missing people and missing our projects and everything else. Can't wait for it to be kind of loosened up a little bit.
So you guys are the founders of Hospital Rooms?
That's right. Yeah, we started Hospital Rooms about 4 years ago. Niamh and I are a couple, which is why we're in the same room at this moment. And we both had a friend who was sectioned about 5 years ago. And when visiting her, we were pretty shocked by how unpleasant the inpatient unit she was in was. And we just had an idea for a single project where we'd bring some artists in to try and challenge what these spaces should be like. And since then, we've made Hospital Rooms a charity, and it's kind of gone from there.
And you work quite closely with the NHS, or at least you did at one point. I don't know if you still do.
Yeah, basically all of our projects are with the NHS, and they're in locked and secure mental health units. So it's where somebody might go if they have been sectioned under the Mental Health Act and they don't actually really have a choice about being there or not. And so we just thought those spaces should be places of inspiration. They should offer you hope for the future, and not convey something of the idea that, you know, you're a lost cause or you've been hidden away or it's anything at all to be ashamed of. And we do that by making them highly beautiful, really kind of visual spaces and working with a really amazing artists to do that. People like Julian, Opie or Sonia Boyce or Mark Titchener, who have those skills and can work with people on the wards to totally change that environment.
So just to be clear, so previously a hospital room of this type would have bare walls and maybe not be particularly inspiring, but then the idea is that you commission an artist to create something beautiful to adorn the walls, the idea being that the artwork somehow enriches their life in a way that it wouldn't have done otherwise.
Yeah, that's right. And they're often pretty dire, these spaces. And we've been to dozens and dozens of these kind of units over the past few years. And almost always the care is exemplary. And it's, you know, there's so many sort of creative and amazing things happening in these spaces, but they're pretty horrible. And they're cold and they're clinical. And beige and white is often thought to be the safe bet for people that are unwell. And we found that that's completely the opposite. And people want stimulation and people want colour, and you know, people want things that'll start a conversation around them. And I guess we kind of think people are getting very good care in these spaces, and why can't the environments care for them too?
So give me an example of one of the artists you've worked with and how they've transformed one of the spaces.
So we have a number of different artists who do this, and they go through a process. So they have to visit the unit, first of all, introduce themselves, get a sense for what kind of care is provided on the unit and what are the kind of safety things they have to take into consideration just to make sure it's still clinical and everything else. Then they run a workshop with the patients and staff to gather ideas, to share their artworks with that community and ask them what they think of them. And then they use all that information to make a work. Mark Titchener is a really great example. He's worked with us a number of times now, but most recently it was on a mother and baby unit down in Exeter in Devon. So it provides care for women who have postpartum psychosis or postpartum depression. And he worked with a lot of the women to talk to them about how they used text or affirmations or different phrases to help them through their recovery. And obviously his work is really based around text and language, so really related to what he does more broadly anyway. And many of the women were incredibly generous in sharing those kind of quotes and things that had helped them. And then he made this quite enormous wall mural that the text was kind of hidden within this really beautiful graphic pattern, and it said "Love reveals the world." So it wasn't something that was kind of too literal or too much related to one individual, but it kind of it sat really softly in the space, and we had great feedback from the community for that.
But the artists, we try and give them a lot of freedom, and we don't try and prescribe how they necessarily go about the project and how their workshop needs to inform the work. But someone like Harold Opie will make a work really in a kind of co-created fashion, so that whatever happens in the workshop kind of almost becomes the artwork.
And Mark Titchener is obviously a really high-profile British artist, in that he was Turner Prize nominated, and he's involved in a lot of public artwork spaces. So it was such a coup to get him, and lots of the artists you've managed to secure are really prestigious. Do you find that they are naturally drawn to helping the NHS, or that it's a charitable cause, or what do you think it is that's attracting them to this project? Maybe it's you guys.
Well, I don't know. Sometimes I don't think we could believe that they say yes to doing the projects.
I think we're always so amazed and surprised at how generous people actually are. And often it's the most amazing artists, the ones that you admire for your, from the start of your career, who you think will never ever work with you, and they're interested in the project. The high profile artists that we've worked with, such as Sonia Boyce or Julian Opie or Richard Wentworth, tell us that they really enjoy the fact that our projects are so challenging and so hard. It's really difficult to come into these spaces and to create something that is for a very particular community in a very vulnerable position. And actually that is in contrast sometimes to making an exhibition for a gallery or something that's much more art world kind of setting. And I think that's a big reason why they work with us.
And are they often surprised, or indeed have you been surprised at the effect that these artworks have? I mean, I sort of feel like when you first pitched this project, I can imagine, and correct me if I'm wrong, but I could imagine there being a bit of maybe people didn't believe that it's something that would necessarily have an impact. And were you surprised, and were the artists surprised at just how much of an impact it did have?
I mean, we went in very naively, thinking that because we find art very meaningful in our lives, other people will in theirs, but it was kind of true. And I think there's certain things that we've found have been important about it that we hadn't expected, and one of that's that feeling of self-worth, and how bringing in an artist who spends a lot of time with people who are often very marginalized and puts a lot of effort into making something really special for a small group of people is quite a meaningful thing, and is a way of telling someone that you care about them. And the other thing is this kind of stimulation, because I think in these kind of spaces it's often thought that the least amount of visual stimulation is the best thing, but actually that could be the worst thing. And white or beige or these blank spaces can be really stimulating in the wrong way. So, I mean, I think a lot of people, as soon as we start any project, can have their reservations, but a lot of what we do is trying to win people over with art, and try and get over this idea that artists are these pretentious know-it-alls that think they're better than everyone else, when actually they're all kind of generally very nice normal people like all the inpatients.
And how has the current COVID-19 pandemic affected what you're doing?
So quite dramatically, we were due to start 4 new projects on the 1st of April, and we'd kind of promised these 4 different communities that we were coming and there would be lots of artistic activity and we'd be transforming their environments. But unfortunately, all the doors now have been locked to external visitors. So there's no way at the moment for us to get in. That puts quite a big strain on us because a lot of our funding is tied directly to delivering projects. So when we can't do them, it puts us into a bit of a difficult situation. We have kind of tried to think around the problem as much as we can, and one of the big things that we're doing at the moment is looking at how we could actually get in digitally, which is something we've never done before, but we know that there is an opportunity to link up with artists through video calls or through different digital means to lead the workshops remotely. And, we'd never have considered doing that before, but in these strange times, you think of new ways of working, and potentially going into the future, it could mean that we reach much higher numbers of people.
How many hospitals are you working with?
So we've just finished 7 projects in different locations. Yeah. So we've worked in London, and the south of England, really. So across to the southwest, down as far as Plymouth, Southampton, Sussex, and then up towards Norwich and Ipswich. So we're trying to kind of expand our geographical reach. We don't want it just to be something that happens in London because we're in London. And yeah, we really want to get up north as well. So the digital side will never replace that kind of human contact part, but if it can complement it and if it can be a new and innovative way of delivering our work, then we're really interested to try.
There's also that element of, at the moment, everyone is confined in a way that the patients you work with are in a way as well. And I wonder if you've noticed or thought about a way in which that it might make people think differently about art themselves, or how their own environment, their own artwork that they have inside their own homes might affect them.
Yeah, absolutely. I mean, I think in a similar way, we're kind of all getting an impression of what it might be like to have your freedom restricted, to not be able to leave the place that you live freely, and what kind of impact that has on you. And that is a very real thing for anybody who's under a section of the Mental Health Act. That choice to go somewhere or do something is very much taken away from you. And I think also, from what we've heard from our community and our friends and everything else, people do think more closely about their environment and do want to surround themselves with artwork or different things that make them feel more comfortable or more or feel better within their space. So I think it definitely is a way that people will build up an empathy for people who are struggling with their mental health at this time, whether they're in a ward or not. And I think, it just demonstrates how the space around you can give you a lift or can give you some hope.
And you are working on some new initiatives with regards to moving it forward. Talk a bit about that.
Yeah, absolutely. So the digital thing is the really big thing that we're trying to do at the moment. We know that visitors and therapy sessions and things like that have been halted in the units because people can't come in. And so they're looking at how you do that through a tablet, or how you can do it through a phone or through any kind of video link. And what we want to do is be leading our art workshops in the same way. So those really high profile artists getting online and getting into those units and leading sessions with patients. So that's a really kind of exciting prospect for us. We're also kind of fundraising to be able to fund that work, because obviously we've had to adapt, we've had to deliver something totally new, and we're doing that with no kind of backing at the moment. So we've done a number of things. The first one is a fundraising campaign that we've launched on Total Giving. That's doing really well, and we're so grateful to everyone who has donated. We've also joined up with Wolfgang Tillmans' initiative, Between Bridges, where he has got amazing artists like Andreas Gursky and Luke Toymans and various others to make posters for £50 that can be sold by arts organisations who are struggling. And we've seen amazing support from that. And we're also working with some of the artists that have been on our projects before, like Anish Kapoor and Richard Wentworth, to release some of our own really affordable but limited edition artworks that people can purchase, and that will be coming out in the kind of middle to end of May. So, we're doing everything possible to be able to reach people and to be able to say Hospital Rooms will still be here on the other end of this,
I think the other thing that we're working on is an art school at one of the units we've been working on. It's a medium secure unit called the Hellingway Centre, and we're working towards making a school called the Hellingway Art School, which will be bringing in lots of artists that we work with to do tutorials and lectures and mentoring sessions, and we'll have residencies there so that they could work with the patients to create new spaces for the unit, and then perhaps collaborate with a well-known art collection and create a kind of museum within the unit that might be accessible by the public, to kind of bridge this kind of totally unseen locked space with the rest of the world. And I guess that's where a lot of the idea for the digital work we're going to be doing came from. But it's something that we want to carry on, and we think after the lockdown finishes, a lot of the digital ways of reaching people in the units that we set up will be able to kind of combine the two, so we can still have the face-to-face, but also have a lot of patients be able to have access to the artists so that they could still collaborate and have conversations and learn from one another. And what would be amazing is if this small medium secure unit that has maybe 60 patients has a program that rivals any of the best London art schools in terms of visiting lecturers. And that's something we're really excited about.
That's really exciting, and it feels so modern, and like you say, it's a real bridge between art and medicine, and so innovative at a time like this. How can people reach you and find out more?
So we're on Instagram. It's @_hospital rooms, and Twitter @hospital rooms. Also, there's lots of information on our website, especially about how people can support and how they can see the new artworks when they come up for sale. And we also have a newsletter. So we're really keen. We're a small charity, so any offers of support, or people getting in touch and talking to us about what we do, we always love to hear.
We also have exhibitions about every project we do, so because the projects are only ever seen by the staff and service users or patients at a certain unit, we always do a public facing exhibition in a really good gallery. So later in the year, we'll definitely have some more exhibitions, and once the lockdown ends, we've got one in Southampton at Southampton City Art Gallery. So yeah, if you keep up to date with what we're doing, you'll be able to come and visit and kind of learn a lot about the project, and see work by patients and the artists that have worked with us.
Well, Niamh and Tim, thank you so much for coming on the In Talks With podcast.
Thank you.
listening to In Talks with me, Danielle Radoichin. The sound and theme music were by Wargie Productions, and the artwork is by Patrick Waugh. If you enjoyed this episode, please pass it on to someone who you think might also like it. And of course, please do subscribe and leave a review. Thanks for listening.